Hi, I'm Dr. Millie Hinkle with Camel USA. Today I want to discuss with you a concern that we're seeing worldwide, and that concerns anesthesia and anesthetics and the camel milk. I've been working with doctors for the last several years from around the world with the concern that they have about patients not being able to handle anesthesia if they're regular consumers of camel milk. What these surgeons and dentists are telling me is that patients are waking up in the middle of a surgery, or they're not being able to put the patient under to do the surgery, or the dentist is telling me that the anesthesia is not working with those patients. So we have a major concern with this, and doctors are having to switch to other anesthesias in the middle of a surgery or to give a patient more anesthesia, and we've had several life-threatening issues happen. So this is what I want to discuss with you today, the fact that you need to be informed of this. Your doctors, your dentists need to be informed of the fact that you are taking camel milk. So if you're a regular consumer of camel milk, you need to make sure that any health professional that you work with is notified, because it could be life-threatening to you. We're also seeing that when patients are taking pain medication, that pain medication is not working properly either if they are consumers of camel milk. So what we need to know is this, that you notify your doctor and your druggist that you are taking camel milk, and they will probably not know anything about it. But what we've seen is that patients are having to take more and more of a pain medication and take it more often, and this has presented serious health concerns as well. So we want you to be aware of that. The fact that so many patients that are taking medications and opioids and they are not working and the anesthesia is not working led me to a discovery. And that discovery was that when we're giving camel milk to addicts, it is having amazing results. So we work with doctors and we work with patients who were opioid addicts, and we're trying to go through a treatment program to get off of those opioids. What we found is when we introduced the camel milk, and there is a specific protocol for that these patients recovered much quicker. The withdrawal symptoms were negligible. They were almost nothing compared to the other patients that were on the traditional drug withdrawal therapy. So we're wanting to do a larger study with opioid addicted patients. We want to do a big study with that. We're looking for volunteers, and we're looking for funding. I funded the camel industry since day one in the United States and all of the studies that I've done. And we desperately now are at a point where we do need funding to carry on larger, more in-depth studies. So we ask for people to contact us if you want to make a contribution, but also if you want to be a part of one of our studies. So just contact Dr. Millie Hinkle at our office, which is 919-561-1545. Thank you.